They are so silent. They're often forgotten, too easily forgotten, the elderly in general, but they're the most fragile. I think over 40% of the death will have happened in nursing homes. Nursing homes are places that have traditionally, fragile people. This is where COVID was the deadliest, frankly. The vast majority of nursing homes are not places where you and I would want to leave our parents. And this is not per se by fault of the people who work there, but it is because of our system that has neglected those places, that has not been funding them well, and that has chosen to let these places be places that are chronically neglected. And so you have an outbreak, huge outbreak like a Covid-19 that hit already a chronically sick institution, and you have an acute on chronic disaster that's very deadly. It's not that these places don't have guidance, don't have guidelines, don't have protocols. They've been, in fact, inundated by these things. What they actually needed were people like us to be in the facility and to help them translate that guideline into actual simple protocol, something that you can implement. One of the most important things that we were able to do was to embed in the facility. We also did classes on infection prevention control, especially targeting clinicians, but also then we separated our classes between the non-clinical and the clinical staff, because we found that the non-clinical staff, housekeepers, people in the kitchen, the receptionists, they're working in those places. They're working in a high-risk environment, but they don't receive the attention that the medical staff receives. The investment isn't much, but the difference is massive. We're not going to get any kind of return from these elderly folks, but that's not how we should be thinking about that and about our elderly, at least in the United States. The way we think is wrong. It's sad. It sort of says a lot about who we are as a society and what it is that we value.